Nasal structures, so very brief, there aren't a lot of structures associated with the nose. We've got the septum. We know about the septum. We talked about the septum. This is what divides the nasal cavity into right and left. It's partly formed by cartilage, partly formed by bone. We've also got the vestibule. So the vestibule is pretty much the opening into the nasal cavities. And then we've got the choanae. So the choanae are these apertures or these openings that communicate from the nasal cavity, which is this region, into the nasopharynx, which eventually communicates into the throat or the pharynx. Let's talk here about the sinuses. So the sinuses are really these hollow cavities that are filled with air, or they should be filled with air, that are inside the skull. They communicate to the oral cavity, to the nasal cavity, and the function of them is really to help keep the head light. So if the skull, if the head were all hollow bone, the head would be very heavy. So the purpose of the sinuses is to create this lighter feel to the head, as well as create the resonance for our voice when we speak. So sometimes you listen to your own voice, as I often do when I make these recordings, and you appreciate this sort of nasal pitch to your own voice, and that is the sound of the air that's vibrating in your sinuses, okay? The sinuses also function to warm and humidify air as you breathe it in as well. Let's talk about the different sinuses. We've got the frontal sinuses, which are right here in between the eyebrows, in the center of the forehead, so to speak. We've got the sphenoid sinuses, which are much more posterior. So it's going to be closer to the pituitary region, right, the sphenoid sinus. Posterior to the nasal cavity, the nasal region. We've got the ethmoidal ear cells, which are really not one big sinus, but very tiny air pockets that are found on either side of the ethmoid bone. And they can be seen here in green. So we want to distinguish the green sinuses, which are the tiny ethmoid ear cells, from the sphenoid sinus, which is much more posterior. And then lastly, we've got the biggest sinuses, which are the maxillary sinuses. These are probably the most important ones clinically. You can often have sinusitis, which is an infection or inflammation of these sinuses, in which case they become filled with fluid. And that's where you sometimes get the heaviness of the head that you may feel when you have a cough or cold or sinusitis, as I mentioned, right? So just to go over those ones again, we've got the frontal sinuses, the ethmoidal ear sinuses, or the ethmoidal ear cells, tiny ear pockets on either side of the ethmoid bone. Posterior to that, we've got the sphenoid sinus. And interestingly, the sphenoid sinus is an access point to the pituitary fossa. So sometimes when you want to do invasive surgery, such as remove a tumor that's on the pituitary gland, we may use the sphenoid sinus as a route to enter the pituitary fossa using a scope or laparoscopically through the nasal cavity. But the sphenoid sinus is a really interesting landmark in that it allows us to communicate right into the pituitary fossa. And then lastly, the maxillary sinuses, which I mentioned, are the largest, the most important on either side of the nasal cavity, are the maxillary sinuses. The last structures we'll talk about are the muscles. So some of our facial or head muscles, the temporalis, which is this large fan-shaped muscle associated with the temporal bone, is really important in our function of chewing and biting and eating. It helps to pull the mandible up, which allows us to open the jaw to then clench the jaw, which is really important action for biting, as well as the masseter, which also helps to pull the mandible up. So we've got the temporalis, this large fan-shaped muscle on either side of the skull, right, in the temporal region, and then the masseter, which is on either side of the cheek, also helping to engage the mandible. The last three muscles here are the buccinator or the buccinator. This is pronounced a lot of different ways. The buccinator, this helps to puff the cheeks out. It's a smaller muscle. It's going to be deep to the masseter. So the masseter is out here for reference. And then deeper and sort of more horizontally oriented is the buccinator. And that also helps with chewing and biting, but in a different way. So it doesn't actually move the mandible, but it helps us to puff the cheeks out, which allows us to move food around within the oral cavity. And that obviously facilitates biting and masticating and chewing of that food. The orbicularis oculi is this circular muscle around the eye, and this is the antagonistic muscle to the levator palpebrae superioris that I mentioned earlier in this lecture. So I talked about the levator palpebrae as being important for opening the eyelids, and here we encounter the orbicularis oculi, which is important for closing the eyelid. So when you squeeze your eyes shut really tightly, you're engaging this circular muscle, which helps to clench down the eyelids. And then the orbicularis oris is a similar muscle, but that is a circular muscle around the mouth, which does a similar action. It helps us to clench the mouth or pucker the lips, which is important for actions like drinking from a straw, kissing, some aspects of chewing and biting, and so on and so